This is Wellspring, presented by Spectrum Health Zeeland Community Hospital on 99.7 and 1450 WHTC.
And for this Thursday, July 8th, we once again welcome via the Zoom connection, Sara Donkersloot. Good morning, Sara.
Good morning, Gary. And it's just a delight to have Wellspring on a weekly basis. It's a live radio show that is sponsored by Spectrum Health Zeeland Community Hospital. And on the other end of the Zoom connection is just a really wonderful person who works in our hospital, Marnie Pierce. She's the surgical services nurse manager, and she is going to be sharing about an exciting new expansion at the hospital, which will benefit our community. Good morning, Marnie.
Good morning.
So, Marnie, what is your role at the hospital? Tell us, what is the surgical services manager? I see you in the back in your Zoom with lots of stuff on the wall.
Well, as you mentioned, yes, I am the manager of the surgery and endoscopy department at Zeeland Hospital. We have 3 operating rooms at Zeeland and 2 procedure rooms. So I do manage that area and all the supporting departments that go along with it.
So, Marnie, what do you enjoy about your work?
That's a really good question. So I really love being able to exceed patients' expectations. You know, surgery is not something that happens to people every day, thankfully. And we strive to make sure that when it does happen, the patient experience has been considered every step of the way. I love working with a great team to make it happen. We feel like family here at Zeeland, and we want to make our patients feel that they are part of that family as well.
So April marked the 15th year anniversary of opening the Zeeland Community Hospital campus on Felt Street. And, you know, throughout the years, Gary, there have been a lot of exciting things that have happened, but probably nothing as exciting as what you and your team are overseeing in the midst of now. Marnie, tell us about it.
Oh my goodness, you're right. So the hospital is in the midst of a surgical expansion. It's an $8.72 million expansion that is the largest facilities project since the original construction of this hospital in 2006. This will be a multi-phase project, which we are currently in phase 2, and it's estimated to be completed and open in December of this year.
And Marnie, I just want to say thanks, in the midst of this interview, because I know that you and your team have spent a lot of time working on this project, and especially to be overseeing a project when you've been able to keep the surgery going in the midst of adding a project to surgery, correct?
Right. Yes, we have been working all through the project, and it's been a challenge, but it's been fun and a lot of learning along the way.
So, Marnie, what was the reason for the expansion?
So, as you know, healthcare organizations need to continually invest and innovate to remain at the top of the medical industry. And through our long-range capital facility plan, the board has carefully evaluated, planned, and executed the best possible solution to ensure that, Zeeland Community Hospital remains a facility equipped to serve our community today and into the future for our next generation.
And Marnie, and part of that is because Zeeland is in one of the fastest growing areas in the state of Michigan, correct?
Absolutely. We are growing so much in this area into Hudsonville and all the surrounding communities, just growing like crazy. So we're always building for the future, and we always want to keep care local. We want to be able to provide care for our community right in the community that they live in.
And well into the future, and that's what this expansion is going to allow for. So, Marnie, you mentioned that we're in phase 2. The project actually began in November 20. So, tell us about the project and phase 1.
So, phase 1 was first building that shell of the project. So phase 1 was building the 2-story, 9,100 square foot addition to the back of the main hospital. So if you drove along the backside of the hospital, you saw that first exterior addition, and that was to create a covered loading dock and a mailroom. It also created some expanded storage space for sterile and non-sterile supplies, linen, and groundskeeping equipment, and to create the shell for the added additional OR space that we were creating.
So, you talk about that space, surgical space that's going to be expanded, but there's also going to be, as part of this project, changes to the main lobby. Tell us about that.
You're right. So the new main floor, which is part of the hospital lobby and the surgery department, is also going to change and create a new entrance for our patient, where our patients will be coming in and the way they access the department. We wanted to create a much more convenient and safe entrance for them. They'll be renovating the lobby area, which will create that welcoming stage as they enter the lobby for all aspects, whether it be entering for the surgery experience, as well as for lab and family birth and the whole entrance into the Zeeland Hospital arena.
I know you're excited about all aspects of the project, but really, it's really going to benefit your surgery team. So talk about the enhancements of the surgical department and, how that's going to benefit not only your team, but our patients.
This is what I love. So, our patients, one new aspect for them will be a new private waiting area. There'll be a new waiting area just for surgical patients where they'll be able to wait and get updates on their loved ones, with private consultation rooms where they'll be able to meet with their surgeons and hear after the surgery is completed how things went and get those updates. In addition, there'll be a small nutrition area in that waiting room for them to get nourishment during their stay and while they're waiting. Another aspect that we'll be gaining is a dedicated C-section procedure room that will allow us to do C-sections without interrupting the other operating rooms. When we have an emergent C-section come up during the day, previously we would have to pause in the daily schedule of our other operating rooms to fit those in. And now we'll be able to go directly into a C-section room that's dedicated for those procedures, along with a PACU bay that is dedicated for C-section patients that the significant others and dads will be able to recover. We currently do allow them to recover with the moms in our recovery room, but this will give them a little bit more privacy for those first special moments after delivery to have that bonding time with their infants, which just makes that time even that much more special. And also, by having those private PACU bays, it also gives us the opportunity to allow parents of pediatric patients to come back when appropriate and have that special time with their patients or with their children when they're waking up when we're able to. So all of those added benefits from this expansion project are going to be really wonderful benefits for our staff and for our patients.
Along with it, Marnie, there's an expanded operating room, correct? That will feature technology. Talk a little bit about that.
Sure. So because we are converting one of our operating rooms into the C-section procedure room, we are building out an additional operating room. And that new operating room is going to be getting some new technology, and the operating room will be using more dedicated for our robotic procedures. It will have some new integrated technology for those procedures, allowing for better monitors and visualization for the procedures themselves, for the surgeons and for the team, as well as growth for future technology that who knows what the future holds and what we'll be able to gain down the road.
So I'm looking at the chat here, and that's the benefit that you have for the chat. And Marnie, Gary has a question that he wants to ask you. So Gary, I will let you
All right, I'll pick up the ball. And by the way, just to let everybody know, we're chatting with Marnie Pierce, who is the Surgical Services Nurse Manager at Spectrum Health Zeeland Community Hospital as part of our weekly Wellspring program. I know that a lot of the expansion deals with things that were planned before March of 2020. But almost to a certain extent, Marnie, the events that have happened since March 2020, when at Zeeland Community Hospital, as well as other medical facilities, they were taxed because of the COVID-19 outbreak. It's almost as if it was providential. Hey, we're doing an expansion and we need it because, we're bursting at the seams, but with people that need treatment. To a certain extent, the timing of the expansion was almost perfect.
Yes, it was. It was.
And I'm going to follow up a little bit with that, because you're right, Gary, when you talk about bursting at the seams, the need for that dedicated C-section, because Zeeland has seen an increase in births. Talk a little bit about that.
Yeah, no, definitely. I mean, in 2019, we saw about 500 births. In 2020, we saw about 750 births, and we're projected to see close to 900, in this next year. We're continuing to see more and more, and just we need to grow with our community. And that's why the dedicated C-section room becomes such an added important need for our hospital and for our community because of the growth we're seeing in this area.
Well, and that does tie in what you said, Gary, because, when you have that dedicated C-section room, like you said, you're going to, it's a procedure room that's going to allow surgeons to perform more surgeries in the 3 operating room, and especially with the expanded room. And that's due to a shift from inpatient to outpatient care, isn't it?
Yeah, it really is. Yeah, we're definitely seeing a shift. It's amazing how many surgeries now are done as outpatient that used to be inpatient. And Gary, as you mentioned, just with COVID and with the shift in trying to move patients, we recover so much better at home, and we're finding that patients do so well, in their own environment, that now we're seeing, same day total joints, people are recovering at home, and surgeries that we used to stay in the hospital for longer, we're now, getting out the same day and doing as outpatient. It's been a real big shift in the hospital setting.
Sara, let me step in for a second real quick, and I want to follow up on the outpatient. And Sara, to be honest with you, I do remember 15 years ago with the groundbreaking of the new facility when we did have many of the key figures that are no longer with us now, but they were here and they made the contributions for that. But the thing is, Marnie, since that time, Spectrum Health Zeeland Community Hospital is involved with urgent care and providing for that. It's again, it's a facilities thing. I think more than anything else, you've got the outpatient, but also urgent care. This certainly will help with the expansion, wouldn't it?
Yeah, and I'm just going to respond to that because, I have been involved with the urgent care. Certainly, you know what I mean? Even in our ER, I'm certain you can talk about that. People come into the ER, right? And, there may be a need for surgery, and, they can have that availability of those rooms, correct? Because of an increase in patients we're seeing in urgent care and ER that may need surgical procedures. I'll let you talk about that because you're the expert, Marnie.
I'm sorry, Sara, you were cutting out just a little bit there, so I missed a little bit of what you said.
So I'll let you speak to the aspect of, ER care and translating into surgeries.
Yeah, the ER care and translating it into the facilities, because certainly urgent care has helped in that regard, Marnie, right, hasn't it?
Yeah, urgent care has definitely helped in the regard to in as far as taking some of the. Are you talking about taking some of the bottleneck off from the ER and caring for some of our patients that used to go to the ER and now are able to get care is more of a primary care setting and getting that type of treatment. And then the ER is able to care for more of those higher acuity patients and allow for that seamless transition should they need surgery and get into a surgery setting should they need it more directly, or in an admission in a setting where they need to be admitted to a hospital setting as far as getting admitted to the floor or in the more higher acuity, scenario.
Yep. And Marnie, we are out of time, and I know we didn't even get to all of our questions, but we're so excited about this expansion. And when do you hope that it's going to open, Marnie, that we'll have access to the procedure room and the expanded surgery? What's the deadline?
Yeah, so we are very excited. We are hoping to open fully by December 2021, so later this year, with all of the renovations from completed in the surgery space to the front lobby and expanded services from all the way from your registration back through the surgery department.
And thanks for being here today, Marnie. We are looking for donations to the project. If someone would like to donate because the project is being supported by the Spectrum Health Foundation, please call Chris Palisari at 616-970-7105 or visit give.spectrumhealth.org/Zeeland, actually /surgery. Until next week, Zeeland Community Hospital wishes you well.